Assalamualaikum and greetings to everyone. We are a group from CDIM1B. The topic for our assignment is Technology in Healthcare. Let me introduce you to our members. First, we have Laila Atika, Mal Quraisha, Alia Izamzuri, Fatini Umairah, and me, Nur Amshar Aima. Care navigates the complex relationship of medical science, compassion, and innovation to protect our physical, mental, and emotional well-being. Digital health platforms is supported to increase public awareness through websites, mobile apps, and forums so that users will stay informed about symptoms and treatment options.
What is EHR and EMR? EHR, Electronic Health Record, is a digital copy of patient's paper chart is called an electronic health record, EHR. It includes an extensive collection of current patient health data. They usually contain a multitude of information, including medical history, diagnosis, prescriptions, plan of care, data of immunization, radiological pictures, and outcomes of laboratory tests. EMR, electronic medical record, an electronic patient record is a digital copy of patient chart kept by a single medical facility or practice. In comparison with EHR, EMR are typically provider or facility specific and may not be readily transferred to other healthcare settings. EMR hold patient data created within a particular healthcare facility, including treatment record, diagnostic tests, result, and clinician comments. What is telemedicine? The term telemedicine describes the use of telecommunications technology to provide medical information and service remotely without having to physically visit a healthcare center. It enables patients to interact with medical professionals, get advice on their health, and even conduct some diagnostic and monitoring procedure. Many forms of communication are used in telemedicine such as secure messaging, email, phone conversation, and video call. With its convenience, accessibility, and responsiveness, telemedicine is crucial in rural areas and during pandemics. Nevertheless, telemedicine may not be appropriate for every medical issue, and in-person consultation may still be required.
Another two types of technology in healthcare is radiology and telehealth. The third one is radiology. What is radiology? Radiology is a branch of medicine that uses imaging technology to diagnose and treat disease. For example, X-ray, CT scan, MRI, and ultrasound are among the technologies used in radiology to capture detailed image, providing valuable information for medical professionals to make informed decisions about patient care. Radiology also plays a crucial role in healthcare by using advanced imaging technologies to visualize the internal structure of the body. It aids in the diagnosis, monitoring, and treatment of various medical conditions. The next part is challenges in radiology. However, challenges and concerns do exist, primarily related to radiation exposure or overexposure. Overexposure to ionizing radiation such as X-rays and CT scan can pose risks including potential damage to cells and can increase risk of cancer. To mitigate these risks, healthcare providers follow strict protocol to limit radiation dose, especially in sensitive population like pregnant women and children. Ongoing research focuses on developing techniques to reduce radiation exposure while maintaining the diagnostic efficiency of imaging procedure. So why radiology is important? Radiology's role is central to disease management. with a wide choice of tools and techniques available for the detection, staging, and treatment. Diagnostic imaging provides detailed information about structural or disease-related change. Early diagnosis can save human life. So next is telehealth. What is telehealth? Telehealth leverages technology to provide healthcare service remotely, enabling patients to consult with healthcare professionals through virtual appointments, video call, and digital communication tools. It enhances accessibility, especially in remote areas, and facilitates timely medical consultation without physical presence. Is there any problem or issue in telehealth? Yes, absolutely it helps because not everyone has equal access to technology or reliable internet. It can creating disparities in healthcare access. Issues like unequal access to technology and internet connectivity can create disparities, limiting some individuals' ability to participate in virtual healthcare.
Today I'm going to explain about robotic use in healthcare environment. So, as you can see in the slide, there's four types of robotic use in this healthcare environment, which is first one is surgical robotics, and second one is telepresence robots. Third one is robotic prosthetic, and lastly, a pharmacy automation. So, I'm going to explain by one for this. So, firstly, are surgical robots, which is advanced robotic system designed to assist surgeons in performing various type of surgical procedure. These robots are equipped with precision instrument and are operate by surgeons from a console. The use of surgical robots has become increasingly common in minimally invasive surgery, providing benefits such as improved precision, enhanced dexterity, and reduced invasiveness. So this type of robots are really popular for surgical performing surgical brain surgical um mainly because there's a lot of nerve that you cannot be touching in brain itself. So imagine if you messed up, that person would die. So the use of this one is kind of like specific. So it looks like the risk of that person going to die is really minimal. So next one is telepresence robots, which is robotic system designed to provide physical present for user present for user in a remote or distant location. These robots are equipped with camera, microphone, speakers, and other sensors, allowing user to interact with remote environment and communicate with people at the remote location. Telepresent robot enable individual to telecommute or remotely participate in activities, offering a sense of presence and mobility beyond traditional video conference. It's like you're playing a video game, but in another place, like Nintendo, but for medicine. Oh no, for surgery, something like that. And lastly, not lastly, thirdly, robotic prosthetic, which is involved integration of robotic technology into the design and functionality of artificial limbs or prosthetic device. This field it has been significant advance in recent years, aiming to enhance the mobility, functionality, and overall quality of life for individuals with limb loss. It's mainly very popular for someone who actually lost their arms or probably legs, and then but they um still want to move their hands, so they replace the robotic one, which is I think it's pretty cool type of technology. It's kind of connect with your nerve, then you can move your arms. Yeah, yeah, it's like for example, like the character from Cyborg from Teen Titans, like yeah, it's like robot body. That's real cool. Something like that. And lastly is pharmacy automation, which is involved the use of technology to streamline and automate various processes in the pharmacy, with the goal of improving efficiently accuracy in patient care, which is technology to make a medicine, which for more accurate missions, something. So as we can see, there's robotics used in the healthcare are really actually quite useful, especially when they want to improve for um treatment for people that really need. So I think it's important. It also kind of like revolutionary for people in surgical, because surgical are not really easy thing to do, especially when you're a human being. Sometimes we make mistake. With the help of robotic, we actually can evolve ourselves to become better at treatments. I'm going to explain the use of the AI in healthcare. So, what is AI? It's an artificial intelligence referred to the development of a computer system that can perform tasks that typically require human intelligence. These tasks include learning, reasoning, problem solving, perception, understanding the natural language, and even interacting with the environment. It aims to create systems that can simulate humans' intelligence and encompasses a range of techniques and approach. So, which long short story, it's a computer, data of computer, which is have a lot of information that may help humans to become more revolution. So, AI also has a few things that can be benefit in healthcare, which is there, as you can see in the slide, there's 5 things that actually can become beneficial for healthcare environment. So firstly is diagnostic imaging. Diagnostic imaging, which is AI algorithm can analyze medical images such as X-ray, MRIs, and CT scans to assist in the detection and diagnosis of various conditions. This can lead to quicker and more accurate diagnosis. So as we can see, diagnostic images is like a page where you use like the picture where they taken from the body and then kind of like expose anything else, the bones and stuff. So this can help doctor to explore more inside what is inside the patient body and detect more what type of things actually disturb for the patient. And secondly, drug discovery and development. So for it's used to analyze vast data set to identify potential drug candidates, predict their effectiveness, and streamline the drug discovery process. This is significantly accelerate the development of new treatments. So, which means there can AI itself can detect if the patients haven't taken drug, and also at the same time they can create a new one because drug is also part of medicine. So which is they can create more, it's kind of like they can create more better medicine for treatment to the patient, something like that. So thirdly is personalized personalized medicine, which is help the tailoring treatment plans based on individual patient data, including genetics information. uh, it will ensure the treatment are more effective and have fewer side effects as they are customized to patient-specific characteristics. I think this is a very important part when it comes to medicine for treatment patient because sometimes medicine can actually actually can affect more patient sickness without knowing it. So by, customize it with using what is the problem inside the patient. So actually we can avoid the side effects are more often and treat the patient itself rather than just giving more side effects. Something like that. So for the population health management, which is help to analyze large data set to identify trends and patterns is valuable to public health innovative resource allocation and preventive care strategies. This is mainly famously for like COVID-19, where experts are gathering in WHO to search research about what is COVID-19, something like that, and then use the help of AI also. And then they use the help of AI to understand what is about the disease itself, something like that. And lastly, a predictive analytic. Um, lastly is predictive analytic and risk of stratification, which is analyze patient data to identify individual at risk certain disease or condition. This is allow for proactive intervention and personalized treatment plans to prevent or manage health issues. So, long short story is like a detective detector type of survey detector type of um item, which is help patient will help the doctor to discover the early stage of patient sickness. So this is kind of like how like an early stage, for example, like cancer. So if doctor can detect, AI also can help is to detect what type of uh sickness that patient have, like for example, like cancer, and so doctor can give like a medicine to avoid from it going spread. So, um, therefore, as we can tell, uh, AI also a very benefit. The use of the robotics and AI also a very benefit for healthcare. So by using this, it also can improve for the treatment and for the better healthcare for the patient itself, without actually avoiding them to having the risk of falling sickness again, or probably worse, sickness.
Now, let's talk about another types of technology in healthcare, which is wearable device and health apps. A class of electronic device known as wearable technology or wearables can be implanted in the body of the wearers, worn as an accessory, or even tattooed in the skin. These are useful hand-free gadgets with microprocessors that are supplemented with internet-based data transmission and reception capabilities. For example, smartwatches, fitness trackers, health trackers, and so on. In the example, like I say smartwatch is a gadget with function like app integration, fitness monitoring, and notification, such as the Fitbit, Samsung Galaxy Watch, and Apple Watch. Fitness tracker are gadgets like Xiaomi Mi Band, Fitbit, and Garmin that track health indicators, sleep habits, and physical activity. And the last one is health trackers are gadgets worn for continuous health monitoring, such as glucose, blood pressure, or ECG monitors. So, the benefits of using wearable technology can help users become more physically and nutritionally fit by giving them access to information about their sleep, diet, and physical activity. Next, we talk about the health apps that we use as a technology in healthcare. What is health apps? Health apps are software programs on mobile device that process health-related data on or for their users. For example, MySejahtera and mental health service apps. But in this section, I just want to share about MySejahtera apps. The Malaysian government created the digital platform MySejahtera to aid in the management and mitigation of health-related issues, especially during public health emergency like as the COVID-19 epidemic. In Malaysia, in relation to the COVID-19 pandemic, MySejahtera has been instrumental in facilitating effective monitoring of the virus transmissions, contact tracing initiative, and vaccination administration. The app's broad usage has been crucial in raising public awareness and encouraging adherence to health precautions, which has aided in the coordinated effort to stop the spread of dangerous disease. By using MySejahtera, people may easily access vital health service and information at their fingertips, while also contributing to the safety and well-being of the country as a whole. The MySejahtera app performs a variety of tasks that support the overarching plan to track and contain the spread of infectious illness. The functionalities that provided by MySejahtera are health monitoring and reporting, contact tracking, and vaccination registration and verification, and so on. With these health apps, it simplifies the person to update their symptoms before go to the hospital.
There are a lot of potential benefits of the synergy between healthcare and technologies, and there are also some disadvantages, such as overexposure of radiology. So, ongoing collaborations, research, and responsible implementation is essential to fully utilize these technologies.